Hello everyone, this is Dr. Sushma Sarilla, consulting homeopath at Homeopathy. Now let us see the pathology. If you see here, this is brain. In the brain we have hypothalamus, right? The hypothalamus is supposed to release GnRH, which is responsible for triggering the pituitary gland to release LH, luteinizing hormone, and FSH. This LH and FSH will trigger some follicles in the ovaries, and some follicles will start to mature. 6 to 8 follicles are released after LH and FSH trigger, and in that one will become the dominant follicle, and the dominant follicle will release the egg. And these follicles, while they are maturing, they release estrogen, and after the release of the egg, these follicles will become corpus luteum, which will release progesterone. This progesterone is in turn helpful in maintaining GnRH. What happens sometimes, we do not know what the exact etiology or the cause is. The GnRH pulsations, and when GnRH is increased, LH will rise abundantly and FSH will fall. LH and FSH should be in 1:1 ratio. Sometimes what happens, because of this GnRH issue, LH will start to rise a lot, and rise in LH will cause thecal cells to proliferate, and this thecal cells will release androgen hormones, that is testosterone. And apart from that, the follicle-stimulating hormone is lesser in quantity. That is why there is no maturation of the follicles. Whenever there is no maturation of the follicles, what happens? There is no release of the egg. So if the follicles are not maturing, the egg is not released. If the egg is not released, then you cannot get pregnant. Apart from that, if there is no maturation, there is no release of egg, right? And if there is no release of egg, there is no formation of corpus luteum also. If the corpus luteum is not there, then the progesterone is also not there too, which will again monitor the GnRH. So GnRH is increasing rapidly without any monitoring of progesterone. So this is a cycle, and whenever there is increase of this androgen hormone, the girls will develop mustache, side locks, beard, and hair on the chest also. So this is the whole pathology that is running inside PCOS. So what you will understand: rise in GnRH, rise in LH, fall of FSH, fall of progesterone. This is very, very important. Then what is the other factor that is important in discussion of this fertility issue is anovulation. As we have already discussed, there is hormonal imbalance, and because of this hormonal imbalance, because of the low FSH level, there is no release of egg. So whenever there is no release of egg, there cannot be fertilization. And also, after using some medication, some people will have ovulatory cycles, but because the period is irregular in nature, for example, if this is the first day of menses, and then from that day to 14th day you have ovum releasing, but here because the PCOS is very irregular in nature, sometimes the bleeding is for 10 days, sometimes the bleeding is for 3 days, sometimes the bleeding does not appear for 6 to 7 months. So we do not know when the egg is actually releasing. So that is why you can have fertility issues even here. Apart from that, we will have fertility issues, and also even though if you are fertilized, that is even though if the fertilization takes place and you are pregnant, you have to understand that they have insulin resistance as well as oxidative stress and metabolic issues. That is, people who are suffering from PCOS can suffer from hypothyroidism, can suffer from diabetes mellitus, and also people who are suffering from diabetes mellitus when they are conceiving or when they are pregnant, that can have an effect on the baby, leading to some complications. That is also very, very important. And apart from that, you will have, even though the egg is releasing properly also, there can be issues in the quality of egg for fertilization. Even though the egg is releasing, if there is no proper hormones to maintain and for the maturation of the egg, even though if the egg is released, the egg is not proper in nature. That is, quality of egg is also very important for fertilization. So if the quality of egg is not good, then that can lead into miscarriages or some problems during pregnancy. Then even if the egg is released, even if the quality of egg is good, you have to remember there is another issue in PCOS, which is endometrial thickness. So what is endometrial thickness, and what happens is that, as you know, that people who are having regular period, the endometrium will start shedding during the period and again reforming after the period. But what happens if you have irregular period? There is irregular shedding of the endometrium. Sometimes it can become very thick because there is no period or menstruation to control it, and sometimes it can become very thin through excessive bleeding. So all of this can happen. Even though there is fertilization in the fallopian tube and the zygote is formed, it should come and get attached inside the uterine cavity near the endometrial layer, which should be able to supply and support the growing pregnancy. But what happens is that sometimes, because of this irregular period, this endometrial layer can vary in thickness and can lead into, even though if you're you got pregnant, it can be the reason for miscarriages in PCOS. Apart from that, people who are suffering from PCOS can also suffer from inflammation and oxidative stress. So in inflammation, certain chemical mediators are released, which is not good for the baby. It can cause autoimmune diseases in the maternal aspect, and also it can cause autoimmune diseases in the future for the baby who is forming in the womb. So that is also very, very important. So what about inflammation and its oxidative stress? If you want to know that in detail, we will be doing a video on PCOS and inflammation and oxidative stress. Do check out our future videos. Here we have online consultation options and offline consultation option. If you're someone who's staying near the nearest branch of Fiticus, you can contact us offline or come and visit us in person. And if you're someone who's staying far away from us, you can contact us online either through audio or video consultation. After the doctor consultation has been done and the investigations are verified, after doctor consultation and after the investigations have been verified, the medicines will be sent to your doorstep, especially for online clients. If you're staying in India, 3 to 4 business days, staying in USA, 3 to 5 business days. Apart from that, anywhere else in the globe, it can take 4 to 8 business days for our medicines to reach your doorstep. If you're someone who would like to get in touch with us, you can contact us on this number, call us, WhatsApp us, or messages on this number. And if you would like to know more about Fiticus Homeopathy, you can check our website www.fiticus.com. We have discussed how homeopathy is a better option in curing PCOS. If you're someone who is suffering from PCOS, PCOD, or female reproductive related diseases, understand that Fiticus Homeopathy is a top notch in curing all of this, because Fiticus Homeopathy stands for highest chance of health. Here we are already treating patients who have PCOS, PCOD, endometriosis, adenomyosis, bulky uterus, and good number of fibroid cases, and also infertility cases. So we are having good success in all of these cases, and also the treatment is transparent, which means there is no gray area between the patient and the doctor. The prognosis will be clearly explained to you, and the personal care here at Fiticus Homeopathy is top notch. We will be bursting all of your myths and educating you on any of the doubts that you ask us. So if you want to choose cure, if you want to choose health, choose Fiticus Homeopathy. Thank you.
Fiticus Homeopathy.